This is the presentation for primary care of the red eye, and you can use this as an MP3 or along with the PowerPoint presentation. As you can see, this is from the Wake Forest University Eye Center. One of the first things to do is to look at when you're dealing with an emergency. One of the number one things is you must document vision. If a patient states they cannot see on a chart, then what you need to do is go ahead and see if they can see fingers, if they can identify light, and that's going to give you a little bit more idea as far as an emergency. But if you ever call an ophthalmologist, make sure you have, if you know if they wear contacts, if they wear glasses, and what their vision is with and without corrective lenses. Now if you look, here is the anatomy of the eye. Conjunctiva, you have the bulbar as well as cerebral. You have the cornea, which is the clear covering over the iris. And then you have your anterior and posterior chambers. Now, when you're looking at this person, again, you're seeing a couple of things. You're seeing that there is a slight haze around the outside of the iris. You can see that there's a slight buildup of substance in the medial conjunctiva. Again, don't put sclera is red. You need to document that the conjunctiva is red. Sclera underneath is more significant. This is what you should be seeing to a limited degree when you do your fundoscopics. My understanding is many people are feeling not real good with this skill. It's actually very important. It's going to tell you in emergencies whether or not they have any brain swelling. And it will also tell you as far as progression of diseases such as hypertension or diabetes. Again, this is a picture of the macula. You get this by having the patient look straight at the light. History. You're going to be asking them as far as why are they coming in. Present status of vision, whether or not they think that visual status. Again, it's your basic HPI, what makes it better, what makes it worse. Have they had any problems with their eyes in the past? Surgeries, what type of medications they're on. A lot of medications can cause dry eye, which can then lead to corneal abrasions. Past systemic history and family history of ocular disease, particularly glaucoma. There is an 8-part eye exam that you need to do, and this is you're looking at the pupil to see whether it is round, the ocular alignment, the visual fields, which is your peripheral vision, tonometry, which is going to be pressure. Again, glaucoma is the great masquerader. External eye and ocular adnexa, whether or not there's any swelling, which you can get with conjunctivitis. Look at the anterior segment and then the posterior segment. Anterior segment is viewed by taking a light and putting it on tangentially to the cornea to measure the distance between the pupil and the cornea. Tools of the trade have a Snellen acuity chart, near acuity chart, color vision plates to see if they have color vision. You're going to need a good pen light, ophthalmoscope. The Woods lamp is used to identify blood or foreign bodies. Again, something so that you can measure the pressure. Tetracycline or these are basically numbing drops which you use. They can be very diagnostic. If you give a drop of anesthetic and the pain goes away, you know it's pretty much on the cornea. Fluorostain is used to dye the cornea, and this can help identify corneal abrasions. And then something to, particularly to have children fixate on. And again, here are some pictures of these things. Blepharitis. This is a chronic inflammation of the eyelids. Think of children who have cradle cap. It's kind of like cradle cap of the eyes. You can have some that's a staph. You can have some that's really just plugged ducts, or it can be the seborrheic. And this is right on the lash line. They are going to have some complaints of burning. This tends to be a long-term condition. They can get some erythema on the lid margins. They'll get eyelash debris, just like on the cradle cap. Sometimes they're going to be more at risk for styes because of the bacteria. And they can get a chronic inflammation with conjunctivitis. Again, it's the same treatment as you would do for cradle cap, which is going to be warm compresses, artificial tears, and occasionally a steroid antibiotic ointment. I do not prescribe steroids for people's eyes, so I would make a referral on that. And this is your classic sty, and that basically is pus, warm soaks. These come on suddenly. People come in usually with eye pain. Viral conjunctivitis, years ago we used to make a real big difference between viral and bacterial conjunctivitis. We did some studies. It appears that more often than not we're identifying bacterial, and so therefore a lot of times we'll go ahead and treat both the same way. However, viral conjunctivitis, I ask patients, did you have a cold lately? And they usually have a fairly acute onset. And usually the second eye will be involved 3 to 7 days afterwards. They will have minor light sensitivity. Someone who cannot sit in a room with the lights on would make me concerned. Again, you're going to see some watery, they'll call it maybe clear discharge. And again, infection control, washing your hands. And here you can see the general inflammation. Bacterial is going to be a specific bacteria, and they look at this and say, well, this is the person that's going to have the matted eyes, the mucopurulent exudate. Sometimes they can actually have swelling to the lids. You may want to, bacterial conjunctivitis, look at a gram stain. That's going to tell me if it's like gonococcal. Usually you're going to be using eye drops. And the Bluff-10 is a sulfa drug, which works well because it's a generic. And again, if you look at someone who has, I'm a big advocate for dyeing people's eyes in the primary care office to see what their cornea looks like. I would also want to make sure that a viral conjunctivitis is not actually herpetic infection. So again, this is, you won't see that many. Chlamydia, again, it's going to be unilateral. And again, a lot of times we don't ask specifically. Gram stain, actually what you have to do is a specific collection for chlamydia. The treatment actually is an oral treatment, which is the doxycycline. And you also will have erythromycin. Allergic conjunctivitis, people are going to pretty much come every spring or their season for allergies. It's going to be more of a stuffy nose. They'll usually know. A lot of times in little kids you can see the allergic salute, which is the child who puts their hand up to their nose. Avoid allergens, cool compresses, and then there are some topical eye drops you can use. Acular works well and it's a good pain reliever, however it's expensive. That ends the first part of the presentation.